Do you feel like this is something that's really impacting your life in a big way, like interfering with your ability to do your work?
I was doing this interview with John Cho.
We all good?
We decided for some reason we were going to do it at the top of this building. I did it. I couldn't refuse. I mean, it's my job.
Yeah.
You know what I mean? And it's kind of hard to explain, but I have a fear of heights. I feel like it's not like a normal fear of heights. I'm worried that I will jump off of things, basically, is what happens.
Regardless of whether or not it's fear of heights or, a form of OCD, the good news is that this sort of issue is one of the most effectively treatable conditions, not just in mental health, but also in all of healthcare.
Really?
Yeah.
Okay.
Yeah.
Wow.
That conversation was real. What's not so real is the way Dr. Aronovich wants to treat me. He's one of about 200 therapists testing a new virtual reality platform with his patients. Most people have only used VR to play video games. But now that VR technology is getting cheaper, people are starting to use it for other things, like therapy. Limbix, a small startup in Palo Alto, is developing VR experiences that mimic real life.
Maybe you can tell me what you're seeing right now. It's a good place to start.
Welcome to Limbix VR. Take a moment to adjust your headset, get comfortable, and prepare for therapy.
Like this driving scenario with variable intensity and danger. The idea is that if someone's afraid of something, the best way to treat them is to gradually expose them to it. And over time, their fear will get less intense, or even go away.
What other kind of environments do you have that you've already put together?
So public speaking is obviously a really common anxiety for people. If you want, you can stand up in front of the crowd. Remember, you can look around in all directions, see your presentation. And then once the therapist decides, okay, Dexter's comfortable talking in front of this positive, casual audience, you can then make the audience angry. Right? We're distracted, we're angry, we're not really paying attention.
Right. I would not have thought of this one. I mean, heights, yes. Cars, sure. This is a little bit off the beaten path.
Limbix's long-term plan is to sell its software to large institutions like VA hospitals and drug and alcohol treatment clinics. So far, Limbix has $3 million in VC funding, and they're 6 months into their testing program with therapists.
So, are you seeing something?
Yes, looks like sand, maybe a beach.
Yeah, great. If you're feeling comfortable, my plan would be to kind of take it up a notch.
Sure, yeah, let's do it.
Okay, I think this one might be a good option.
Take it to the edge here.
Nope. Nope.
Okay.
I would never do this in real life.
Okay, what's the sense right now?
The sense is, why am I here?
Okay, hold on 1 second. I think you should be transported to a bridge.
Gabe?
Yep.
Did you just take it to 11? Is this 11? Just be honest with me.
This is it? I mean, it's dependent on you. Does it feel like an 11?
I mean, I don't know how much higher you could take it. This is pretty bad.
So is this 100 out of 100? Is that what you're saying?
We're pushing 80 and 90. Yeah, this is up there.
Well, let's stop here. Whenever you're ready, I would say go ahead and take that
Sure.
headset off.
Whoa, hi.
Yeah, hey, welcome back.
What's up?
Yeah. So, yeah, how was that for you?
So it felt realer than I thought it would.
Interesting.
Yeah.
You know, it's still different than actually being there,
Sure.
right? But it's impractical to go there.
Yeah.
And so this really kind of bridges us between, office-based imaginal exposure, where I just ask you to imagine it, and being there.
Dr. Aronovich says that properly treating my fear of heights could take a few months of VR sessions. Considering I figured I'd have to be terrified of ledges for the rest of my life, that doesn't sound so bad.